Very good evening. Welcome to BCN News. As we now enter the tropical cyclone season, it is forecasted that there is an increased risk of tropical cyclone activities for Niue. For the 2019 to 2020 tropical cyclone season, it's expected that about 1 to 3 cyclones may cross near Niue, and 2 cyclones are predicted to reach categories 3 to 5 or become severe. The Met Office says everyone should remain vigilant and prepare throughout this tropical cyclone season. The director of Niue's Meteorological Service, Rosie Misiepo, says communities are advised to continue to listen to the radio, watch television Niue, and follow the Met Office Facebook page for weather updates. All alerts, warning, and advisories should be seriously considered whenever it is issued to reduce the risk of life, livelihoods, and property. The 2019-2020 tropical cyclone season for Niue officially started on Friday, 1st November and ends on 30th April 2020. About 83 cyclones have passed within 500 kilometers of Niue since 1969. 8 cyclones have crossed within 50 kilometers of Niue. Cyclone Hatta being one of the most devastating cyclones that hit Niue 14 years ago. The Health Department aims to immunize all residents of Niue in light of the measles outbreak in Auckland, Samoa, Tonga, and Fiji. Director General for Social Services Galen Tasmania states the Health Department will endeavor to do so as vaccine stocks arrive. As part of efforts to protect the local population from this contagious disease, Tasmania says they are seeking help from the general public. If you have children under your care who are under the age of 5, please check their immunization records to see whether they have been fully immunized with the measles, mumps, and rubella vaccine. If in doubt, please visit the hospital. All children aged between 12 months and 4 years should be fully immunized against measles to ensure full protection. This includes older children who have come from overseas and are in your care, but you are not aware of their immunization history. If you are unsure of whether your child has been immunized, please contact the hospital. If you are a mother of an infant who is less than 12 months of age, please continue to breastfeed your baby because some level of immunity or protection passes from you to your child. If you are planning on traveling to New Zealand or any of the Pacific Islands, please contact the hospital at least 2 weeks before the date of travel to get a booster shot. A booster is provided to people who have already got some level of immunity. If you have family who are planning to visit Niue from New Zealand or elsewhere during the festive season, please inform them to go and get immunized at least 2 weeks before they travel to Niue. The hospital is not in a position to provide immunization to families visiting from overseas, as their vaccine stock is for local residents only. It is important that immunization is carried out 2 weeks prior to any travel, as the virus can infect a person but no visible symptoms are seen in the first 2 weeks of infection. In this time, the infection may have spread to others, especially those who are not immunized. If you have recently returned from New Zealand, Samoa, Tonga, or Fiji, and you feel unwell, please visit the hospital and seek medical advice as soon as possible. Do not wait. The public health team will continue to carry out a systematic vaccination program for border control officials, health workers, education workers, business owners, and accommodation providers in the next few weeks, and will continue as vaccine stocks are replenished. There are a couple of other infections that have been recently noted by the health department, particularly among young children. Chickenpox and hand, foot, and mouth diseases have been spreading, and parents are advised to please keep the children at home if they are not well and to visit the hospital for treatment and medical clearance before allowing your child to attend school. The public is being advised to be on alert and to help stop the spread of all infectious diseases through proper hygiene. These infections spread by contact and through droplets from coughing and sneezing. Please continue to wash your hands, cover your mouth when coughing, and keep food and other surfaces clean. NCA students have started their exams today. Year 7 to Year 10 students are now undergoing final assessments, with parents being urged to ensure that they attend school daily. High school principal Charles Ioane says the prize giving for 2019 is set for 6th December. He says the NCEA consultations with the New Zealand Ministry of Education will continue in week 3 with a visit from the team that were here earlier in the year. There will also be sessions held with parents. This week, Ioane says the teachers underwent a professional development with colleagues from Howick College on restorative practices for student behavior. He says this would enable teachers to be better equipped to deal with student behaviors and practice more effective teaching and learning processes. The USB Council has announced the appointment of their commission. They are Professor Satish Chand, Professor Jenny Light-Tollers and Graham McNally. These appointments follow the USB Special Council meeting in August, where the Council resolved to appoint a commission to lead the implementation of recommendations in the BDO Auckland report and other matters relevant to the sound operations of the university. Through the work of this commission, the Council states they are confident that USB will continue to strengthen and grow as a regional learning and research institution. The commission is expected to commence in late November 2019. And that's BCN News for tonight. Thank you for joining us. Do join us same time next Monday. Until then, have a safe weekend.